Welcome back to the King's Podcast, The Wellness Dive with Lackie. I'm your host, Esther Lackie. Today is World Prematurity Day, a day that we put a special spotlight on premature babies. We are joined by Dr. Maria Theresa Reyes, consultant neonatologist here at King's, and she'll be telling us about the day as well as what happens in the intensive neonatal unit. Thank you, Doctor, for coming.
Good morning, Esther.
Hi.
Thank you for having me here. It's lovely to see you. It's World Prematurity Day, and we as neonatologists and together with our colleague pediatricians and all of our nurses and doctors here in the hospital are very happy to celebrate World Prematurity Day.
All right, thank you. It's such a pleasure having you here, knowing how busy of a clinic you have. So, World Prematurity Day, what is it about?
So World Prematurity Day actually started in 2008. Well, just to give you a brief background, prematurity is one of the most challenging conditions that affects our children. About 1 in every 10 children are born prematurely. About 15 million children are born, and about 1 million of them are quite premature babies, and about 1 million of them die. So it is the main leading cause of mortality and morbidity for our babies under 5 years old. So that in 2008, a group of people, it actually started with the European Foundation for the Care of Newborn Infants, together with other European counterparts, especially in the UK and neighboring countries. They have established World Prematurity Day, actually to establish awareness. It's a global awareness to kind of like make the world aware of the impact of prematurity and the impact of premature babies into the life of their families, and basically just to promote the welfare of premature babies and raising awareness and assuring that they have a good start in terms of their future. Sadly, of course, not everyone survives. As I said, maybe 1 in 10 would not survive. And so we do celebrate the ones that we have now and who are lucky to survive the challenges of prematurity. But we also remember those that we have lost on this day.
Wow, that's a very important and touching job you have there, Doctor. Each year on World Prematurity Day, there is a theme. What is this year's theme and what does it mean?
Yes. Yes, you're right. Every year we have a different theme for World Prematurity Day. Last year it was during the COVID time, and the theme at that time was zero separation. So it was a timely kind of theme because we try to endeavor to still keep families together during the COVID time. This year we have a unique one. It's actually a parent's embrace. It's a powerful therapy. We need to establish skin-to-skin contact from the time of birth.
Wow.
So this is basically kangaroo care. This is raising awareness that, we establish bonding between the baby and the mother right at the very time of the first minute or the first second after the baby is born, as long as the baby is stable enough to do that.
And what is the importance of kangaroo care?
So kangaroo care, I think it has been known to not just establish bonding early between mother and baby, but it's very important for establishing or regulating their temperature right at the time of birth. When you put the baby to the mother's chest, the baby actually becomes calm. It's thermoregulated. They establish a good temperature. It actually eases and calms the baby's heart rate. The baby learns to kind of get accustomed to the mother's warmth. And also it has been found with researchers that babies who are doing kangaroo care, who have established bonding with their mother, skin-to-skin contact, they have higher rates of survival.
Okay. And the kangaroo care, the skin-to-skin contact, is it only with the mothers or anybody else can do it?
In here in Keynes, we actually establish contact not just with the mother, but we also with the father. So we actively engage the father because sometimes I think the father is the most neglected part of the triangle. He's actually the most worried part, worrying about the mother and the baby. So after the mother has had the kangaroo care, then the father can have the kangaroo care. Even this is not just at the time of birth. Even for premature babies, say for example in the neonatal unit, once babies are stable enough to be cuddled, then we do kangaroo care for them, either with their mummies or with their daddies. So it's good.
Wow, beautiful. So about NICU, is it only for preterm babies, or other babies who are born with certain conditions can also be there?
So neonatal intensive care really spans a wide spectrum. So we do premature babies, that's correct. We do from like 24 weeks, even 23 weeks and beyond. But neonatal intensive care is for every baby who would need attention right after birth, who for one reason or another is not able to adjust properly after delivery, or they're unwell because they're not able to breathe because they're too premature, or they need extra support. However, we also cater for term babies who are also unwell and for some reason or another cannot make it immediately to go with their parents in the postnatal wards. So it's basically most of the time for premature babies, but we do cater for very sick term babies as well.
All right, thank you, doctor. In detail, what kind of care is provided at the NICU?
Well, the neonatal intensive care, I think sometimes for some people can be a scary thought, but actually the neonatal unit is divided into 3 levels of care. So we have obviously the neonatal intensive care, which is reserved for babies who are born premature, babies who are very sick, who's needing a lot of support for breathing and treating infections and treating their current conditions. But we also have that level of care where we call a high dependency care for those babies who probably do not need as intense support as the others, but somewhere in the middle, just needing a little bit of breathing support or establishing feeds. And there is another level of care, which is our NICU observation, where we kind of just have the babies to just for mere observations for a few hours or a couple of days, and then they get back to their postnatal wards.
Now, I can imagine that the parents of these babies, they're scared, they're stressed, for lack of better words. How do you help them? How do you support them through the process?
Okay, in King's Neonatal Unit, we endeavor to make it one of our targets to actually inform parents, if not right after at the time of birth, but within 24 hours. So it's very important for us that as soon as a baby is born, that one of the consultants, I am not the only consultant, by the way, I should probably mention my colleague, Dr. Hari Kumar Nair. He is also one of the other consultant neonatologists. Plus, of course, with our junior doctors, we endeavor to kind of like inform the parents as early as possible, updating them with their baby's condition, because it is very difficult for a parent to imagine what's happening behind the doors, for example, when we're trying to resuscitate a baby. So as soon as we've stabilized a baby, or during stabilization, one member of our team is already updating parents. And then we do encourage them to actually join our rounds, the consultants' rounds, the physicians' rounds, because we want them to hear for themselves exactly what is happening. And then that is also a chance for them to ask questions for those things that they don't understand, or for the things that they need clarification. We at King's also endeavor that we make our parents the partners in the care of their babies. So we do propose the treatments, we discuss the treatments, we kind of explain and get parents' contribution or their ideas, whether they agree or not agree, and then we kind of come to a compromise. So we always make it a point to update them and to make them partners in their child's health care. So they are important partners for decision making in the treatment of their babies.
So do the parents stay here at the hospital accordingly to how long the baby is going to stay?
No, not always, because say, for example, a mother gives birth naturally. So if they deliver by vaginal delivery, they will only stay in the hospital maybe for 2 nights and 2 days. Now, if that's the case, and if the child still needs, or the baby still needs to be in a neonatal unit, and they are already discharged, we encourage them to come to the unit. It's unrestricted, 24/7, obviously apart from the 1 hour or 2 where the nurses are handing over, so they can see their baby anytime. So they can always ask for an update anytime as well. Now, say for example, for those mothers who delivered by cesarean section, they have a longer time in the hospital. Whenever they are already mobile, understanding they can be in pain, we always encourage for them to be brought down in wheelchairs if they are comfortable to do that, in order to see their babies in the neonatal unit. So somehow they see the baby's condition and, not just imagining, The other things that we do is make it a point, if they can't come down, is we take pictures of their babies. And then when we visit the parents in the postnatal wards, for example, then we show them the pictures and the videos. So at least they are still connected with their baby.
Yeah. Wow. Apart from the parents, is anyone else allowed to visit the baby?
Yeah, that's a very good question, because as an offspring from the COVID era, I will now say it's an era. Hopefully, it's gone. It's still probably lingering, but during that time, we are only allowing parents to actually visit their babies. This is strictly for infection control, and we try to be as fair as possible for anyone. But of course, there may be special considerations. We're trying to see whether we can relax those regulations now that the environment is getting better in terms of COVID. So we're looking forward to that. Because previously we have allowed, say, for example, siblings, because it's very difficult for some children to imagine saying, where is mommy's baby, where is mommy's baby?
Sure.
So now, hopefully, if the COVID situation is really going, on an all clear, then we can allow siblings to possibly visit, obviously at a restricted time, as well as some grandparents. Before the COVID season, we were allowing at least 4 people nominated by the parents to see the babies apart from themselves, but they should always be accompanied by either one of the parents. So we're looking forward to resume that, provided we're given an all clear.
Thank you, Doctor. So back to King's NICU. What level is it? I hear they come in levels. And what's the minimum number of weeks
that we cater for? So King's Neonatal Intensive Care Unit is actually a level 3 neonatal intensive care unit, which means we can do babies from 23 weeks onwards, and we provide level 3 neonatal care. We can do advanced modes of ventilation, we can do cooling therapy. The only thing that we cannot do is, of course, cardiac intervention, and at the moment, neonatal surgery. So that has to be referred to quaternary centers like Al Jalila.
All right. Do you get other preterm babies from other hospitals referred to you here?
Yeah. Well, we do get referrals for other premature babies. Kind of the Dubai system is still evolving in terms of referrals, but I do get a lot of premature babies who are referred to my clinics for further management after delivery in their own hospital.
Wow. All right, Doctor.
I think the youngest one that we have is a 22 plus 6 weeker who is currently under my care as an outpatient. But our youngest in King's are 24 weekers who are 600 grams, and she's now 2 years old.
Okay, so what do you mean by she's under your care as an outpatient patient?
Yeah, so these are patients, preterm babies who are being referred to us, or the mothers choose to come to us for premature care, continuing care in King's. So we're kind of proud of that.
That means they've already been discharged.
Yeah, they've been discharged because usually after a baby is discharged from the neonatal unit, we follow them up in our neonatal clinics or in our pediatric clinics. In terms of neonatal follow-up, we see them through until they're 2 years of age, because at around 2 years of age, they would have caught up with as like a normal term baby would have been at 2 years of age. So we follow them closely. So if there's anything that is kind of like concerning, then we can address them early.
So you're a consultant pediatrician as well?
Yes, for you to become a neonatologist, you become a pediatrician first, and then you subspecialize in neonatology.
And you follow up with these children up to what age?
We follow up these kids up to 2 years of age.
And then you hand them over to
Yes.
the other pediatricians?
Yes, that's right. Even within those 2 years period, we kind of like focus more on their neurodevelopment and their well baby care and supporting them through. But say, for example, for other baby needs, like if they get unwell, for example, they can't be readmitted anymore in the neonatal unit. So you will have to have a pediatrician to look after them, say if they get unwell in the pediatric wards. So it's really a partnership.
All right. Over the course of your career, do you follow up with these preterm babies up to, I don't know, they get old and older?
Yeah. So I think I think that question probably is like, what is the outcome of these premature babies? Yes. So before coming here, I was a consultant at King's College Hospital in London. So in our mother hospital, and obviously King's Hospital is one of the frontiers for premature care in the UK. We have the lowest mortality rates in the whole of the UK, and that is what we are trying to do here as well. Everything that we do here is based on all our guidelines and all our practices in King's London. So far, in terms of preterm outcomes, we do have an inviable survival rate of about maybe 99.6% across gestations, and we have very little morbidities. So what we can see is that the babies who are under our care, modesty aside, I should say, we were blessed with babies who are actually thriving really well. And if they are not, comparable with their peers, they're even advanced with their peers. So we're really blessed to have our preterm babies thriving and with very, very minimal morbidities. They're actually very, very good, and we're very proud of those outcomes. Of course, we're still going to do formal neurodevelopmental assessment scales for them at 2 years, but so far, subjectively, they're flying, and we're proud of them.
Wow. On a personal level, do you stay in touch with their parents or the babies themselves?
Yes. I think most of our preterm babies, the patients I've had in King's are actually still sending me messages or emails. And one patient even said, "Oh, I found you right halfway on the globe." And they would just update me and say, "This is your baby now. Look at how well they've grown." In King's in Dubai, my WhatsApp is full of my babies, so they kind of like update me. It's very good because you get a lot of messages from them whilst they are small, and then they're getting better and thriving once the messages are getting less and less. But then it's really nice to receive messages like, "Doctor, your baby is now 1 year. You look at your baby, this is now..."
And they call them your baby.
Yes, they call them, they tell them it's your baby. It's their babies, but they become my babies as well. Yeah.
How does that make you feel?
It makes me really, really proud. I must say, being a neonatologist can be really consuming in terms of your energy. But I guess I went to neonatology because I like to do it. I like to make a difference into small babies' lives. And even if I'm tired and exhausted because of long hours, when you've got a sick baby, you just have to be there.
Yeah.
And we're typically very hands-on. Me and Harry will be typically hands-on. It's exhausting. You get sleepless nights. Sometimes you don't get to go home. But then when you see your babies thriving, when you see your 25-weekers growing to 2.7, being like 500, 800 grammars, and then become 2.7 and going home, that's more than enough of a reward.
Wow.
Yeah.
Beautiful.
And I think the most important thing actually is one thing that I would always emphasize. It's not just having a baby who's alive, but rather we actually focus more on having a baby who will have a good quality of life after. So the management that they get is not geared towards just making them survive, but rather having a very good outcome in the future. And that's why we say, in King's, we're very proud to have minimal morbidities.
How young was the youngest premature baby to be under your care over the course of your career?
Yeah, over the course of my career, I have a 23-weeker, where he was 22 plus 6-weeker, who was 350 grams, back in King's College in a hospital in London. We call him David. David is probably grown now.
How old do you think he is now?
He is probably about 5-6 years old now.
Wow.
Yeah. Of course, it's not just me. It's a team.
It's teamwork.
Neonatology, neonatal intensive care is not just a job of one neonatologist or two neonatologists. It's not just a job of me or Harry, but it is actually a job of the whole team. We will not be able to do it without our nurses, without our doctors, without the admin staff who are supporting us, but more importantly, we won't be able to do it if we don't have the parents actively involved in their care.
All right, doctor. Thank you so much. It was a pleasure really having you here, and we are all so proud of you and the job that you do with these little angels.
Thank you very much.
Yeah. Until next time, bye-bye.